Hello, everyone. This is Jonathan Edelheit with the Medical Tourism Association, broadcasting live from Dubai, United Arab Emirates, during Arab Health. Have a really exciting webinar today on, I feel like, a cutting-edge topic, the 3 keys of success for global buyers in medical tourism. We have some amazing panelists that have really created a diverse, I think, group of experts to cover topics from some of the most emerging markets in the industry. So we're going to be covering aspects of, global insurance companies, from the medical tourism facilitator side, from the hospital perspective, from the social media side, and also from the accreditation and the international patient services. We got people, our speakers come from all regions of the world. And we have Dr. Hady Hedaya from Bupa on with us. We have Karen Timmons from Global Healthcare Accreditation. And we also have Ran Yang from SeeHealth in China, who is a leading medical tourism facilitator, bringing in complex cases of Chinese to the US in a very sophisticated manner. Ran, I would love for you to jump in and introduce your 2 partners and co-panelists.
Okay, thank you, Johnson. We have invited 2 guests from China, and one is Dr. Gao, who is practicing medicine for 30 years in the People's Liberation Army General Hospital in Beijing, China. And he is also serving the president of China in the past 15 years. Another is Mr. Zhang. And Mr. Zhang is a group administrator that's called the Home of Love, and he has been helping a lot of brain tumor patients, especially children in China. So there are 2 guests of ours.
Great, thanks, Ran. So this is, we're gonna focus first, jumping into some questions for our panelists, and cover China first, and then we're gonna kind of jump into the Saudi Arabia and the GCC marketplace. It's also an open forum for any of our panelists to jump in at any point. 2 of our Chinese panelists are coming in via audio. So if you don't see them, you're gonna hear them during the presentation live via audio, where the rest are streaming in via video. So excited to kick this off to look at the perspective of China, U.S. healthcare, and then also the GCC perspective. So the first question I have is for Mr. Zhao is, what is your background in the medical field and in China?
高老师，麻烦你讲一下你的那个就是你的那个医学的一些见识，就是历史。
好的，刚刚呢，西图的那位女士呢，已经简单介绍过我了。我本人呢是已经从医了这个在解放军总医院呼吸科呢从医了30年的历史。那么我曾经呢在过去的15年中也为中国的这个主席看过病。那么我主要所从事的方向呢是对这个呼吸系统的这个疾病的诊治和治疗，就是也包括一些这个重症患者。我曾经也在这个欧洲也学习过，同时呢也参与以及执行了一些在中国的一些科研项目，包括这个肺癌基因的检测，肺栓塞，以及急性肺损伤的一些这个呼吸人工通气等等。那么在解放军总院呢，我也是一手建立了这个我们呼吸科的这个 ICU。
Hello everyone, I'm the interpreter for Dr. Gao, and just now Ran has a brief introduction for me, and I have been practicing respiratory medicine for more than 30 years in the People's Liberation Army General Hospital in Beijing, China. And I am honored to be one of the treating physicians for the presidents of China for the past 15 years. And I diagnose and treat difficult respiratory diseases and provide treatment to critically ill elderly patients. After being trained in Europe, I carried out a series of clinical and basic researches in China, and I conducted researches on various topics, for example, lung cancer genes, pulmonary embolism, mechanical ventilation for lung injury, etc. I also established respiratory ICU in the General Hospital. Thank you.
Mr. Gao, what do you think about the current state of healthcare in China, and where is it today?
好的。那么我的工作地点呢是在中国的首都北京。那么北京呢也是有着中国最大的、最好的医院。那么尤其是最近几年来呢，有一些很好的、很积极的变化，比如说我们也在有一些新的医院也在这个建设当中，我们给这些医院呢也配备了非常好的、非常高精尖的一些医学技术，但是呢，目前对于中国14亿人口来说，我们的这个医疗资源，包括这个医务人员都是有所短缺的。打个比方说，中国最顶尖的医院呢，只占到这个全国的7.7%。而且呢，在中国一个医生呢，他就要面对6666个患者。那么跟这个世界卫生组织发布了这个国际标准来说，他是一个医生呢是面对的是1500到2000个患者。同时呢，中国的患者他在没有很好的途径去接受一些新的药物或者是新的治疗方式尤其是在这个一些很严重的疾病，包括这个癌症的新药，或者说是这个包括这个质子治疗，有一些这个研究显示，一个新药就是国际上诞生的一个新药，从它诞生之初起到中国市场呢，大约是需要这个9年的时间，就是在美国的 FDA 批准之后，它要进入中国市场呢是9年的时间。
I work in Beijing, and Beijing has the best hospitals in China. A lot of positive changes are happening, such as new hospital buildings are built and equipped with the most advanced technology. However, there is a severe shortage of healthcare providers to cater to 1.4 billion population in China. For example, China's top hospitals with the highest international rankings, representing 7.7% of its medical centers, handle 50% of its outpatient care in China. And there is one general practitioner for every 6,666 people, compared with the international standard of 1 for every 1,500 to 2,000 people, according to the World Health Organization. Also, patients in China have limited access to new medications and procedures, especially in critical illnesses like cancer medication and proton therapy. In accordance to some surveys, the time for new drug coming into China after previously being approved by the US FDA is 9 years. Thank you.
Mr. Gao, what is the state of medical tourism in China, and are you seeing any changes?
是的，在过去几年中呢，中国的病人呢开始就是会去选择去海外就医。那么在中国国内的一些这个海外就医的一些这个医疗机构呢，也开始帮助这些病人呢去转诊到海外的医院。那么美国可以说是在海外就医当中呢是比较受这个中国的患者的欢迎的。那么虽然到目前为止还没有准确的数据来表明中国每年有多少人去这个海外就医，但是呢大部分有很多的这个数据都显示仅仅是这个去年1年去美国海外就医的患者呢就超过了7000人次。那么其中的其中的75%，那么都是去这个看癌症的。
Yes, in the past couple years, patients in China start to inquiring treatment options abroad, and some medical tourism facilitators have reached out to doctors to refer patients to them. The US is enjoying a record number of medical tourists from China, though there is no precise data right now indicating how many Chinese go overseas for medical treatment. But various sources estimate that far more than 7,000 Chinese patients went to the US last year for medical care, and about 3/4 of them sought treatment for cancers. Thank you.
Mr. Gao, you chose to partner with SeeHealth and Rand's company to refer patients from China into the US. Why did you choose SeeHealth?
是的，其实呢，为什么选择这个稀土健康来转诊这个患者呢？进行海外就医呢，现在有很多的这个理由和原因了。但是呢，最重要的一点是，那么我认为稀土健康这家公司呢，它完完全全是以患者为中心的一家公司，完完全全是在为这个患者服务。到目前为止，我通过这个稀土健康转诊的患者呢，都收获了非常好的这个治疗以及这个就诊体验。那么当他们在国外治疗之后，然后回到中国，那么我也可以继续去跟进他们在国外的一些治疗方案。那么这呢就帮助我就是更好的维持跟进这些治疗，而且我知道稀土健康这家公司呢，他们只跟这个JCI 认证的这个医院进行合作，那么这就更加能够对这个患者的海外就医的质量呢提供了保证。
There are many reasons why I would like to refer patients to SeeHealth, but most important one is SeeHealth is patient-centered. It is a patient-centered company. So far, the patients that I have referred to SeeHealth have achieved great results and experience, and they have great follow-up service, so that after my patient returned to China, I am still at the same page as foreign hospitals. This helps me provide continuous care with a treatment plan suggested by foreign hospitals. And I know they only work with JCI accredited hospitals, and that provides the highest quality of medical care to patients. Thank you.
Dr. Gao, why have you given priority to U.S. hospitals when it comes to patient referral from China to an overseas medical facility? And, what are the advantages that you see in U.S. medical care?
好的。那么，就最近几年啊，这个海外就医，这个趋势呢变得越来越流行。我想呢是有这个多因素的，包括有这个医疗费用的因素在里面，包括这个对于一些比较特定的一些这个治疗啊，它有一些等待这个时间的因素在里面，以及呢这个国际这个长途旅行它的这个花销，它的这个便捷程度，以及呢还有这个在某一些国家呀，它的在医疗技术以及这个治疗的标准上面的一些这个方法的不同都有关系。那么近几十年来吧，美国呢始终都是走在这个医疗发展的，可以讲是走在医疗发展的前沿。那么它也是这个整个这个医疗行业的一个，可以讲是一个风向标。那么我想最重要的一个驱动因素吧，是这个就患者海外就医最重要的，为什么选择美国最重要的一个驱动因素是美国确确实实有很多的这个创新药物以及这个治疗方法。那么根据我的这个理解呀，我所知道的，从这个我查过数据，从1996年到这个2019年年底，那么美国的 FDA 呢，一共批准的是618个创新药物。那么在相同的时间里面，欧洲和日本呢，它批准的创新药物呢，都在这个400个左右，是少于美国的。那么光2019年一年，就有这个46个创新药物，那么得到了美国 FDA 的批准，那么其中12个是这个抗癌药物。除此之外呢，在2009年到2019年11月份之间，那么被美国 FBI 批准上市的94种这个创新药物呢，至今呢都没有这个被这个欧盟日本或者是中国的这个药监部门批准，没能进入这个我们自己的这个市场。那么这是第一个因素。那么第二个因素呢是现在呢中国的病人啊非常这个渴望去能获得一些更好的这个医疗服务的这个体验。那么其实这个可能全世界也都知道，就中国现在这个医患关系呢，可以讲也是比较紧张的这个包括这个医护人员也好，还是患者也好，对他们两方面来说都是比较紧张。那么中国的患者呢，可能会认为，既然我自己呢花了钱，那就需要就是得到自己理所应当的一些这个医疗服务。那么在这样的情况下呢，美国的医院就是可以成为这个我们中国患者的一个比较好的选择，因为呢我们在美国的医院可以接收到更加专业、更加这个先进的医疗这个医学治疗，同时呢我们也可以收获一些好的这个更加专业的这个医疗体验。
Well, factors that have led to the increasing popularity of medical travel include the high cost of healthcare, long wait time for certain procedures, the ease and affordability of international travel, and improvements in both technology and standards of care in some certain countries. For decades, the progress made in the US medical care has been regarded as the weather vane for the whole industry. The most energetic driver is that the US provides more innovative drugs and procedures than any other places in the world. To my best knowledge, between 1996 and 2019, the US FDA has approved a total of 618 innovative drugs. During the same period, the EU, EMA, and Japan PMDA both approved around 400 drugs, innovative drugs, respectively. The year of 2019 alone has witnessed 46 innovative drugs being approved in the US, 12 of which are anti-cancer drugs. Furthermore, between 2009 and November 2019 alone, there are 94 innovative drugs which came into the market only in the US. None of them has ever been approved by the EU, Japan, or China as of now. The second reason is that Chinese patients are eager to seek and enjoy better medical services in addition to advanced medicine. The ever-deteriorating doctor-patient relationship is frustrating both patients and medical practitioners in China. Patients think that they deserve more than what they can get from the hospitals. In such case, the US hospitals can be their choices since they can be offered with professional and high-quality medical services throughout the whole process. Thank you.
John, I wonder if I might add a comment to add on to what Dr. Gao has said.
Absolutely, go for it.
Okay, he had mentioned that one of the reasons he had used SeeHealth and choosing US hospitals, and one of the key factors was the continuity of care and the aftercare that is provided in the follow-up once patients arrive back in China. And I think here in the United States, the emphasis on patient engagement and patient-centered care is very high, even though hospitals are still trying to catch up with the changing consumer patient. Really, since the advent of the smartphone just 11 years ago, patients and consumers have really transformed their expectations of the services and the organizations that they rely on, including hospitals and healthcare. This also does impact healthcare. So patients are looking for more empathy. They certainly expect a good clinical outcome, as Dr. Gao had mentioned, but they also expect a good patient experience. And so looking at hospitals that really have good patient satisfaction, good patient experience scores is very important. It's been correlated that hospitals or clinics that have those good patient engagement scores also have better clinical outcomes, have better financial performance, and have a more satisfied staff, so that therefore, obviously, when they're caring for patients, they do well in trying to engage with them. So patients want empathy, they want access to technology that helps them engage with their caregiver, and I'm sure that's something that could be done in the follow-on. And when we're dealing with medical travel, obviously it's much more complex than going to your local hospital, whether in China or in the United States. And there's issues of the pre-arrival, the exchange of medical records, understanding the cultural implications and language of the patient as they come, and really having that special focus on the patient all throughout that medical travel care continuum. And at Global Healthcare Accreditation, that's one of the things that we focus on, that is really, in addition to the clinical accreditations that the Joint Commission provides, that really looks at the quality and patient safety, and we're looking at the patient engagement along that entire continuum of care, from the very point that a patient starts inquiring about medical travel to when they arrive back home and what the follow-on is. So I just wanted to mention that there's a changing patient and changing patient expectations along with seeking a good clinical outcome.
Thanks, Karen. I think that's some great insight, and I'm going to make a comment, and then offer, if Hady or Rand, you want to jump in from what Karen said, what I'm about to say, but I've been in some meetings this week in the United Arab Emirates, and it's very clear that if we're like, this is for hospitals anywhere in the world, but since Dr. Gao was talking about U.S. hospitals, is that it's all across the board, the patient experience with the U.S. hospitals. Feedback, is that, there's hospitals that are loved, that have an amazing patient experience plus great quality outcomes. Then there's hospitals that have varying levels of the international patient experience. And then it goes to the spectrum of hospitals that have a great brand and great quality, but a terrible patient experience, where 50 or 60% of the patients being sent there by a government or insurance company are actually complaining about the patient experience. And I think there's kind of a misconception that if a hospital has a great brand, they must have a great international patient experience, where there's not necessarily a correlation, and that there is no standard that hospitals are using across the board, and there's tremendous inconsistency. And I know, Karen, that's what GHA's, bringing to the table with some of the top hospitals. So I don't know if Dr. Hady or Rand, you have any comment on that.
Yes, let's start to agree about the point of the patient experience, because the journey of the patient will reflect the adherence of the groups or clients to the insurance. I will talk about the insurance part or point of view, that we are the paymaster for the patients referring from Saudi Arabia or from the Gulf to United States. And the important issue that when the patient come again from a return back from the United States, the positive story and the success story will reflect our business here in Saudi Arabia, because if the client or the employer of this patient, of the member, got the positive attitude and positive experience in the United States, this will increase our sales with other groups and with other employers here in Saudi Arabia. So this differentiates between insurance company from other insurance company, that not all the insurance companies here in Gulf produce or propose for international referral service. So if we are offering this service, we must, not should, we must do it in perfect way, and this is will not grow up and will not complete it without the support of the hospitals in the United States or in the worldwide. So the patient experience is the most important pillar for us as the insurance point of view.
Yeah, thank you, Karen, for mentioning patient experience, because this is actually one of the main reasons that people go out from China to US or other countries for treatment. Because in China, it's overcrowded, first of all, and people do not actually have much commercial insurance. They all use what we call kind of a like social benefit in China. So basically, there's no service or patient experience as such in local public hospital system in China. So when we are thinking about patient experience here, of course, the hospital will provide from their side to have caring staff and very clean environment, and we are providing all the language service. We have people with the patients all the time to just take care of all their needs and their whatever they want also. After treatment here, when they go back to China, because there's a big gap between either treatment plan or aftercare services, we try to accommodate that also. And in terms of technology you mentioned, I think that's a great point, because in here, no matter what hospital, actually big hospitals or or Sutter or even John Muir Hospital here, they all have apps or online account. But in China, no hospital have those things. We are here to taking care of all the international patients, kind of online account here, because they don't read or speak English. We have everything here for them, and we translate everything and from their online account back to their primary doctor in China. So just in order to make sure we maximize the treatment plan continuity.
And John, you talked about brand loyalty or reputation of an organization and brand. And what I think people are finding is that customer loyalty, which obviously comes about from patient experience, is really impacting over time a brand and its reputation. And you can understand that, especially now in the 24/7 social media where people can post things and they give their reviews. I know that the 2016 US healthcare consumer statistics, and I think it was a surprising result, found that 32% of patients said that was their highest indicator of whether they would go to a hospital, was what type of reviews they heard about the organization. And obviously, one bad review can negatively impact the patient through their, not only their personal experience, but also in having others not go to that organization because of that review. And estimates have placed the lifetime estimate of the value of a patient at approximately 1.4 million. So when patients have a bad experience, choose to go elsewhere, that money also goes with them, along with anyone who is influenced by that negative review. So it's something I think in the social media era that we are currently living in, you know, an organization's reputation or brand could be impacted very, very quickly, as we've seen, you know, with some of the airlines and some of the experiences that had nothing to do with safety. The airline arrived on time, passengers were safe, but the experience of passengers, you know, on an airline, and it's seen throughout the world within a day, you know, I think it's really, very important. And in medical travel, you know, risks are very high because there's so many different complex legs of that journey for the patient. And it's really important to mitigate those risks. And that's where, you know, I think the standards that GHA offers really help an organization to understand what they need to do to enhance the potential of a very good patient experience and also a very good clinical outcome.
So as we talk about social media, I want to jump over to a question for one of our panelists, Dr. Zhang. You know, I know you've been building an offline patient group, you know, really in social media for patients in China who are suffering from brain tumor. And I think this is a very important topic because I think we don't hear about a lot in the industry, patient groups and social media and online groups of how patients are finding information, you know, how they're being helped, being guided for medical travel. So Mr. Zhang, how are you involved in helping them?
那个张老师，你麻烦您说一下话，然后这边就是说，您的问题，麻烦您回答一下。
大家好，我是这个地爱之家的张小白。就到目前为止呢，我们差不多有一个超过3000名这个脑瘤患者的这个病友群。这个病友群里包括了像这个胶质瘤、脑膜瘤等等一系列这个脑部肿瘤的患者和他们的家属。这其中80%呢都是儿童。当然，我们这是一个患者自助的一个组织。除了帮助这个患者跟患者之间，还有他们的家属之间建立联系之外，我们也帮助这个患者跟他们的医生建立联系，因为这个在中国相对是比较困难的。然后我们也帮助患者接受一些最先进的脑肿瘤医疗科学的讲座、病例讨论等等这些医疗活动。
Okay, hello. I'm Zachary. I'm the co-founder of SeeHealth. So I will translate Ms. Zhang's talk. Okay. So basically, Ms. Zhang is the founder and an administrator of the Home of Love. So they have more than 30,000 brain tumor patients. 80% of them are children. It is a self-help group. Besides connecting patients to patients, they also help them connect to local doctors, scientific lectures of brain tumors, case discussions, and other medical events activities.
What is the experience in working with these patients?
那个张老师，麻烦你那个说一下，就是你觉得现在就是跟这些病人这个的体验是怎么样？
这个从我们的感受来说，跟病人还有他们家属在一起来看的话，这些病人和他们家属，他们实际上是非常这个不幸的，因为除了他们所遭受的疾病痛苦本身，他们还要面临在就医过程中看病时间长，一定程度上的误诊、过度治疗导致的医患的信任问题。而且实际上我们每天接触的大部分病人都是儿童，所以让这个工作实际上是有非常高的这个挑战性的。我们都知道，不管是在中国还是在其他国家，孩子都是家庭的希望，所以每一个父母都会不惜一切代价为孩子寻找最好最有效的治疗方法。我所能做的呢，就是向他们介绍和分享国际上包括国内最先进的一些这个治疗的信息。我一直坚信，没有一个孩子会被抛弃，每一个孩子都应该获得更好的生活和未来。
Okay, most patients in the group are frustrated with different reasons. Besides the illness itself, they are dealing with long waiting time to see local doctors, like trust issues due to the misdiagnosis and overtreatment in China. The fact that great portion of patients they're dealing with every day is children, that makes a really challenging job. They know like all that children remain as the hope of the families, so the parents would go any lengths to seek the best and most efficient therapies for their children in any cost. So what they have been doing is to introduce and share with the patients about the latest information about the worldwide advanced medical therapies, and he always bears in mind that no children, no single child would ever be left behind, and all children deserve better life and future. Thank you.
No, I think that's important. I think it's an awesome, service that you're providing. And I agree with you that, children should not be left behind. And I think it's awesome that these parents are willing to spend, whatever the cost is to make sure their kids have a better future. So one other question I have is, with these brain tumor patients that are coming to you, why are they asking, to go, get treatment abroad from China and come into the United States? Well, maybe while we're waiting, Rand, I'll jump over to you, and maybe Dr. Zhang can answer that question after I throw one or two questions to you.
我要现在说吗 ？OK， 就我觉得就是像高主任所说，导致国外这个医疗越来越欢迎的因素，一方面包括了我们国家治疗质量这个等待的时间比较长，以及跟这个医生和患者之间的这个医患关系信任问题。某种程度也有一些是这个新的治疗方法，特别对一些这个重症治疗方法，我们国家暂时包括药物暂时还没有办法能够获得这样的治疗。然后比如说像在这个脑瘤方面，脑瘤是整个医学界我相信是非常有最具挑战性的这个难题之一，特别是对于儿童患者。所以很多我们的这个患者的家属，他们的父母在中国最好的医院尝试了各种各样的这个选择之后，往往还是没有获得他们想要的治疗方案，最终还会找到我们去咨询。所以去海外治疗可能是他们最后的机会。就像我们刚刚所说，他们会不惜一切代价，那他们一定会尝试这样一个不错的机会，而且这个机会往往也会得到一些正反馈。所以我想这也是我们能够帮助到这些患者和他们的家属、他们的父母，这是我们的工作的意义所在。
we've maybe lost a translator for Dr. Zhang.
Hello.
Hello. Will you be translating that last question, the answer, or should we jump over to Rand? Okay, Rand. Maybe you could tell us, a little bit about why did you found SeeHealth? What is SeeHealth about, and the role that SeeHealth performs?
Yeah, I was working on, I was actually come to the state to study, and after my undergrad and grad school, I started working in clinical field in New York Presbyterian Hospital in Columbia Medical School, and I have been working with different patients, including international patients there, and I see a need there. Also, a lot of it starts off, friends or families asking for health checkup actually, because in order to book a health checkup in China, you have to wait. If you want to book the best, you have to wait for like 4 years. So, they're saying, why not going to other places? And people start going to, Japan and US. US is the best, but it's quite far. But from my friends or a classmate, their families are coming visit or attending graduation ceremony. So they're coming anyway. Kind of help booking the health checkup called executive health care, and they almost all of them after attending or having the checkup, they feel it's so different and that they loved it. And I was working in research side, and then more and more communicate with patient. I think it's better to direct working with patient in clinical side, and I found SeeHealth in New York then, and to help patients who do need better patient experience and also better care, because for critical illness like cancer, the waiting list plus the lack of latest treatment, especially medication, people can have more options. And SeeHealth working with all different hospitals in different countries. All of them are JCI accredited, but not everyone can afford US healthcare. So we're working with like Singapore, Japanese, or even India hospitals also, so that we kind of match the patient individual profile to their medical needs plus financial profile.
Now, Rand, you're also a member of the Medical Tourism Association. Why did you join?
Because first of all, it's a new industry. Even in the US, in China is also like super new. And we do need a lot of guidance in the beginning. Of course, ongoing, we need connections, support, and even legal guidance. It's a very serious industry because people trust us to pursue medical care. We SeeHealth, at least, we do not offer, like, for example, cosmetic surgery treatment, things like that. We only focus on critical illness. So for us, it's more important to know the legal side or all the liability of this industry and how to provide the best care, because for them it's not only about a trip with some medical benefit. It's really literally the survival part, and we don't want to. We are facilitating them, and we want to provide the most over standard service to them.
So Ryan, another question I have for you, and then I'm going to jump into some questions for Dr. Hady, is what's the role of the facilitator, and how how important is that from the China outbound market perspective? Because there are some people in the industry that say, oh, facilitators don't have a role in medical tourism. They're not needed. I think there's a very valuable role that facilitators can play, or we call it intermediary. What is that, and how important is that specifically for the Chinese market?
Yeah, I think it's specifically very important for Chinese market. For other countries, they may not have, for example, the language barrier, but in China, that's definitely one of the largest barrier they have. And because of China is a completely different system, they don't have much information about the latest treatment, for example, because China is not having Google or YouTube or any of this, and people there, when they got sick, especially critical illness, they got psychologically panicking also. And as a facilitator, I think we are here to make sure everything goes smoothly, starting from picking the right and the best hospital and doctors for that disease. Also to facilitating the language and stay, all the accommodations, and also aftercare, because patient is dealing with the illness, and their families are also with them, but they cannot do everything, and it's a very actually stressful and painful experience if you don't have someone there for you to go, and imagine going abroad with a different culture and booking everything on your own is like a lot of work. So as a facilitator, as I said, we're making sure everything goes smoothly, and when they go back home, they can also have a continuous care going on in China. That's why we are also working with local Chinese hospital and even aftercare centers.
I definitely agree with that. So Dr. Hady, we were talking about patient experience, things like that. For an insurance company, I know with you and with Bupa Arabia, it's not just about expectations, it's about providing beyond expectations. What does that mean?
For the insurance company, we have many pillars for the medical tourism, not only the patient experience, but our experience with the hospital. Because we are not a facilitator or intermediary like other companies. We are covering the patient from A to Z since the traveling date till returning back to the kingdom. So there are different pillars. First of all, like we said about the patient experience and the medical outcome and the facilitations that the patient will have in the hospital during his journey or her journey till the treatment done in the United States. But also we have a lot of aspects with the hospital regarding the billing, the medical updates for the patients, and regarding the acceptance itself and the picking the appointments and continuing treatment or follow-up treatment with the patients in the hospitals. So the logistics or the administration part between the insurance company and the hospital, it is the most important part, subside to the patient experience part.
Karen, do you have any comments on that or opinions?
Well, I certainly agree with Dr. Hady that it's much more complex, and I know insurers who have commented on our standards. In fact, one insurer actually asked that we make a recommendation, we make a revision to our standards when we had our field review on transparency of cost and what happens if there's a complication, because they said that it was so important, and this was one of the most egregious things in their having to deal with patients who didn't understand the billing, didn't understand, thought something was covered and it wasn't. So I think transparency is certainly very, very important. And one of the things that I think organizations who have achieved GHA accreditation, they really have, put themselves out there. They're really demonstrating a commitment to be transparent, to utilize best practices with respect to medical travel. And certainly the insurance companies, I think, are increasingly looking at metrics for not only the clinical outcomes, but also, as you mentioned, patient engagement and other metrics in order to send patients to organizations and make sure that the entire experience yields good outcomes, better financial outcomes, as well as good patient experience.
Dr. Karen, that the story for the industry of medical tourism started with the government in the first part, maybe 10 years ago, and thousands of patients were referred and shouldered by the government or by Ministry of Health or the Embassy of Saudi Arabia, United States, or in the Europe. But after the industry is growing up and the patients in need and seek for the medical treatment outside of the kingdom, the insurance company started to have these services within the insurance company, not now with the government. So the patient referred from kingdom to United States either by two options, shouldered by insurance company or by the government. When the insurance company interact with the hospitals, so as you said, there is multiple requirements because now the procedures or the process not with the patient and the hospital only, it is with the insurance and the hospital, and the patient by 100% is away from this process and the complexity of this process. So this is the new challenge and the new era for the medical tourism industry, which is growing up in the Gulf region, especially.
Yeah. I think what you have just said really shows the evolution of medical travel. And for years, it really, I called it the Wild West in some ways because it was completely unregulated and organizations did, what they felt was best. But really, there has been no set, what are the best practices that every organization that treats international patients, what should they be doing? And how do you assure that? And what is the trust that a patient who's going to that organization, the confidence that that patient can have in that organization? And certainly clinical accreditation is very important, but also a medical travel accreditation, which looks at all of these complex issues that a clinical accreditation does not. So I do agree with you that I think the time is now for having more oversight of organizations that are providing medical travel, having more consistency and understanding what the expectations for care should be and what the standard of care is. So I'm very
just to let me know that one of the top hospitals in the United States informed us that there is a only building, especially for the international patients only, for all specialties. So this building only for international patients and for the patients and the relatives for them. So they will not be lost in the map how to go to the clinical. Just one building for all specialties for only international patients with the interpretations with all facilities and services for international patients. So United States is going very fast in this industry. So I think this is the main reason why patients referred from Gulf region or from the Arab countries to the United States.
Dr. Hady, a question.
I think there are hospitals, and actually GHA is accredited consultant cardiac care in Saudi, and they have seen a major increase, 147% increase in their patient satisfaction scores since getting GHA accreditation, because I think they found the standards embedded best practices and things such as making sure that knowing who your international patients are or your traveling patients are, what their cultural comfort food is, so that the hotels that are taking care of them, are they serving the comfort food as appropriate? There's quite a bit that's very, very, very important. Thank you.
Dr. Hady, a question I have for you is, how does an insurance company, how important is it from a brand perspective? It's going to be two questions in one. From a brand perspective, is medical travel Like how do they differentiate themselves from another insurance company? What do they need to do from a brand perspective? Is that important? And the second question is, how do international providers actually, how can they help insurance companies with that and support them?
I think for the first question, the insurance company referring the patients for treatment, this is the first reason. And for that, many patients here in Saudi Arabia, why seeking referring for outside of the kingdom? There are two reasons. First of all, the failure of treatment here in Saudi Arabia or the GCC countries, and we have a technologies here in Saudi Arabia, but the fastest technology or the most modern technologies and the most modern therapies is not existed here in Arab countries. So we need to refer the patients outside. Also, for the hopeless cases, like Dr. Ran said about the critical illness and the transplant procedures, we have a lot of stories that were rejected here in Saudi Arabia for transplant, heart transplant, and kidney transplant, and lung transplant. And when we offer these medical reports in the United States, they accepted it. And for the surprise that the cases were treated 100% and go back to Saudi Arabia after transplant done in the United States. So this is the amazing stories. For the second question, which related to the what we need from the international provider, like Dr. Karen said, the title of transparency. That's it. Transparency in giving the appointments, giving the medical updates, giving the invoices, itemized invoices, everything in the procedure, financially, administrative, medically, if it is going under the transparency title, it will be perfect for the insurance company and to have a very good and great partnership with the international providers.
Dr. Hady, pricing versus quality, is one more important than the other? How is that perceived from an insurance company perspective?
The quality is the main pillar for our business here in Saudi Arabia and Gulf region, because if the case going to United States are not treated well, either medically or in the administrative part, on the cultural part, in the religion part, and come back again with a negative impact, this is will reflect us and reflect our business with the clients or with the employer here in Gulf region. So the quality in everything, not only in the medical outcome for the disease, and everything related to the patient is very, very important to us, because we are growing our business on this service. Because as I said before, I mentioned before that not all the insurance company offer the international treatment. So when I take the decision of the risk to have this service and have the premium from the client to treat the patients, I have to offer them a very good treatment in all aspects.
You know, Karen, the question I have is, in order for, I think, hospitals to get clients from like Dr. Hady or from Rand's company or other companies, they need to have a good patient experience and standards in place. You know, what insight would you have on how an organization can begin to implement this, or how do they improve their existing patient experience?
That's a very good question, Jonathan, and I think there's been certainly a lot of focus on how to improve patient experience. With just training is certainly a basic frontline aspect. Training doctors on how to have more empathy for patients and caregivers, not just doctors, but caregivers as far as empathy. Maybe establishing patient family councils where you engage patients to give feedback to the organization, and do surveys certainly with medical travel patients so that you're getting input on how to improve the process, what their perspective is on the experience that they had. In hospitals, as Rand had also mentioned, it's so important to have some technology to really start building some applications that patients can engage in self-care. They want to monitor their glucose levels. They might want to monitor their blood pressure. It's very important. Patients are expecting those types of things now to enhance their patient experience, as well as to keep in continuous contact with the organization. With medical travel, I think it's very important that an organization, have an established department. Now, Dr. Hady had mentioned this hospital that had a certain actual clinic or hotel type setting for international patients and their family. That certainly is the ideal, but not everyone will be able to afford that. But to identify international patients so that everyone in the organization, housekeepers know that this is an international patient. All the caregivers know, and to have advocates for those patients, having the considerations, as Dr. Hady said, they're very, very important that should be done. And we are very happy to train organizations on what they might be able to do to enhance their patient satisfaction scores, and also to provide best practices that they might want to emulate.
Yeah, another question I have for you, Karen, is what's the correlation of patient experience scores with better financial outcomes or better clinical outcomes? Is there any correlation or alignment in regards to these three measures?
Yes, that is a very important piece, Jonathan. It has been proven in numerous research studies, and I'm happy if any of the participants listening would like to have that, I'm happy to share the research. But there certainly has been alignment that shows, and research has demonstrated that organizations having high patient experience scores are much more likely to have good clinical outcomes, better financial bottom line, which when you think of it is really not surprising, because obviously they're building that customer loyalty, they're building their brand, they're getting repeat customers, they're getting a good reputation, all of those things their financial bottom line. And it also has been shown to correlate with staff satisfaction. So within their organization, they might have less turnover, their staff are happier. And so patient experience is a very important piece of an organization's future, really, I think, as far as their success and viability.
Hady, a question I have for you is, what are the challenges for international referrals from an insurance point of view? And how, as an industry, can we solve this or get over these issues and challenges together? Oh, Hady, you're on mute. We can't hear you.
Okay, we have two issues till now we faced, especially with the United States as an example, that there is a restricted policy or regulations in the United States that they don't deal with insurance company outside from United States directly. So we have to have the third party or other insurance company to cover our patients on behalf of our insurance company in the United States. So we need to have some flexibility to deal with the hospital directly as a paymaster for the patients. This is the first challenge. Second one, we have issue in the table of benefits. We will go deep in insurance terminologies. This is table of benefit that different from Arab countries in the United States. For example, in the United States, dental and some outpatient medication is not covered as per policy in the United States, but in our policy, it is covered. So this may make some discrepancies with the patients, our patients in the United States. So we need to have a special table of benefit for the international patients to be implemented with the insurance companies in United States to cover the patients. So these are the two reasons or two concerns till now we faced with international business, referral business.
Well, that's very good to know. Ryan, as a medical tourism facilitator, what are challenges that you face, that you would like to see solved in the industry?
We have, for example, we have I think a common challenge that all the facilitator has, which is, patient trust. On how you make clients trust you as a facilitator, they, make them choose you. And also another challenge that is sometimes we also overtrust clients. In a sense, clients are sometimes telling us a healthier picture of themselves than they do. They want to get treatment here, so they say, I'm physically well so far, or I am I'm ready to fly or something, but actually they're very sick. This is one of very common challenges we always be cautious about, because when they're too sick, even they arrived US, they're too sick to get treatment, and then things get more and more complicated here. That's why also a lot of US hospitals choose us, because we have a rigorous screening of patients. We contact their primary doctors in China. We get every medical record we can get from them to get a more authentic picture of how well the patient is, the current condition. And we also kind of screening, we cannot screening their financial background, but we can make sure that all the payment will go smoothly. Also, this is another common challenges, and the solution of it is just more cautious screening of the patient, and contacting just talk more with their caregiver and primary doctor. Definitely, we have to get the clearance of physical condition. And I think, yeah, that's it. That's three main challenges we have faced so far.
Just to add one thing for the challenges, if you excuse me, Jonathan, when we are using another company to cover us in the United States as a TPA or third party, this increased the bill. So the services which done, let's say, for $100, after we seeking another company to cover the patient, it will be $200. So this is affect our growth and our referring process to United States.
Yeah, that's a big deal. It's a huge increase, and I'm sure it's not just in cost. I'm sure that delays certain things too. Like it makes things less efficient in the process. Karen, are there challenges that you see in the industry? And are there solutions that GHA offers to solve those challenges?
Yes, I certainly think as patients are increasingly involved in the decision making with respect to where they want to go for their care, and whether they're doing it through their insurer or a facilitator, they want evidence. So they're looking for outcome data. So what might be the not only the patient satisfaction scores, the clinical outcomes of both the physician and the organization, things like morbidity or infection rates, things like that. And healthcare in general, I think, has been slow to provide some of this transparency, as Dr. Hady mentioned. And so it sometimes is difficult. One of the things that GHA has implemented as part of its requirements is that there be more monitoring data specifically for the medical travel patient. Because just think, there's very little data that's out there as far as medical travel patients and their outcomes, and whether it's the same or different than or lower or higher than patients who might be going to a hospital that are local. So I think it's very important to push transparency, to push more data, and to share it, to have benchmarks that people are trying to compare themselves with. When you look at the hotel industry, such as, TripAdvisor, there's so many, hotel.com, there's so many different ratings where, and certainly healthcare is a little bit different, but I think patients and consumers certainly are looking for more of that. And we certainly have much more to do in the technology aspect to meet the patient consumer expectations. Do you find that, Dr. Hady or Rand, do you find that as a reluctance to share data with patients? It's hard to maybe to get that necessary link to them.
After a long time with the cooperation with one hospital, they lastly accepted to share with us the data.
They left you, did you say?
Reluctantly shared
the data. Yeah.
Yes.
It's so I think organizations, insurers, facilitators, accreditors, I think we really need to be pushing this, and it will take time, but I think the consumer will demand it in the long run, and insurers probably will demand it. And if hospitals want patients, that's something that. But we're working to really try to have some benchmarks that can be used and indicators that can be used globally, so that we're talking about apples to apples, and we hope to see some of those results and be able to publish research on that.
So as we wrap up the webinar, and I think this has been some great insight, I think we actually probably have brought all the stakeholders together. The only one we haven't had is the hospitals, insurance company, facilitator, accreditation, doctor, social media, group. So I think it's very diverse perspective. Do any of you have any advice? Hady, do you have advice for an insurance company on the webinar or another hospital? Rand, do you have advice for facilitators or hospitals? And then Karen, same thing. And that could be advice of mistakes you made or things that you'd like to see them do. Could be anything. Your insights for your insights or vision for 2020. We'll start with Hady.
Yes, I think we need a lot of meetings or webinars like that, and we will conclude the minutes of meeting for this webinar. And we need to have the important stakeholder, which is the hospitals or the organization responsible for the hospital procedures in the United States, or who regulates the process of international referrals. Because if we conclude these minutes with this important stakeholder, we will achieve a desirable goal in the business and this business. I think now we will go to the implementation phase, not to have the ideas only, to go to the implementation phase, because the industry is growing.
Rand? Oh, you're on mute.
Okay. I said, as a facilitator who helps critical illness cases, we see a definite increasing demand, because, by data after actually by 2020, China, 25% of Chinese population are over 60. So that we can see an increasing huge demand. And for here, we also hoping the U.S. hospitals and maybe other foreign hospitals also, it's a lot of illness, critical illness cases are very urgent. We hope that we can get a kind of faster response, as always, instead of we keep pushing. And as Karen mentioned, we also would like to have more transparent data from the hospital. Also, in critical cases, they are oftenly not able to travel abroad at the same time. So regarding remote medical opinion, we need that service also very urgently. And a lot of hospital who is international offices, they provide international patient services, but not really providing the remote, part, like second opinion over video conference or even written. They don't have those services. I hope more hospitals can open that service.
Karen?
Well, I think what I see is potentially that we should not underestimate the influence and the power of the consumer patient. And certainly the industry is evolving rapidly. It's growing. I mean, Price Waterhouse estimates that by 2021, the medical travel industry might reach 125 billion worldwide. And it certainly is getting more complex. I think, as Rand mentioned, you know, they're providing treatment for more complex cases. And I think that is what will be happening. People will not just be going for plastic surgery or dental, but as more patients are having to put in more of their own financial risk to either seek quicker travel or quicker treatment, more affordable treatment, more high quality treatment than might be available within their local country, they're investing more. And so they want to have trust in the organization. And how do you have that trust? By having more external validation of that organization that provides confidence to the patient, that they will provide good clinical outcomes, a good patient experience. And certainly I think by looking for an organization that is indeed practicing international best practices such as GHA, making sure that clinically accredited is very, very, very important. But organizations that are just starting out, I think there's lots that they could do to implement a medical travel program, you know, through training, through identifying who their target, what they feel their differentiated best practices are with respect to treatments and protocols, which countries they might want to target. So I think there's a lot that could be done through organizations' website to become involved in this industry, and it's a very exciting industry. So I just say don't underestimate the power of the patient or the consumer.
That's great advice. You know, I think for me, what I'd like to see in 2020 is, you know, everyone following standards, providing the best experience for patients, you know, more options, us breaking down the barriers in the industry that hold patients from traveling or, you know, make it more difficult for insurance companies or facilitators or other buyers to do business. Because, you know, we can call these challenges, they're also barriers, right? And what's happening as an industry, it's, you know, it's on a one-off basis. We're not solving these challenges. We're not breaking down these barriers. You know, as an industry, I mean, that's one thing that Medical Tourism Association is focused on 2020, to break down the barriers so this industry can grow. It's easier for insurance companies like Bupa Arabia or businesses like SeeHealth, you know, or, you know, Dr. Zhang's organization to refer patients. It's easier for patients to access information and travel abroad. And I think that we, you know, everyone in the industry needs to look at, you know, how can I excel as a business? How can I make it easier? How can I do better? You know, just like I feel like, you know, Hady is that, you know, you're at the top of the game in the industry, you know, and doing the best that you can. You're committed to, you know, I'm not just doing this, it's going to be the best of the best. I think, Rand, you're doing the same. That, you know, I mean, that's the whole vision of GHA. And I think that in the industry, not everyone does that. You know, they just, I'm going to try to do, you know, the best that I can. I'm not going to be the best. Or I'll take shortcuts, you know, or these things are not important. You know, let me focus on price and not quality, or let me focus on this. Like if I have quality and pricing is good, I don't need to worry about the patient experience. But all these things, you know, I think people forget medical tourism is not easy. And it's medical experience, but it's someone traveling to another country. I mean, you can't put more problems that could go wrong, and to turn that into this perfect experience is extremely challenging. And you know, but if you get that recipe right, that's what makes a successful business and a successful brand in the industry. I really want to thank, you know, our panelists. I think you guys have been awesome, brought a lot of diversity. You know, hope, you know, that people listening on this webinar want to partner, get guidance from, you know, like people like Rand and Hady and Karen, you know, or visit them at our conference, one of our conferences or workshops around the world. One of the things I want to wrap up the webinar with is just to share with everybody, you know, I hope everyone on the webinar considers looking for 2020, doing things differently, joining the Medical Tourism Association and becoming a member. We actually rolled out all new membership benefits in 2020. We also rolled out a new Elite and Elite Premium that even we were looking at how do we help in breaking down barriers in the industry and helping organizations succeed. And that's, you know, like, for example, if it's a hospital or a facilitator, you know, looking at how are you communicating with patients, and, you know, assessing that and making recommendations. What does your collateral look like if you're a facilitator or a hospital or even insurance company, you know, and helping us, you know, us helping you make recommendations to make changes, add information, so that there's more confidence and trust and you're able to convert more patients. Looking at your process flow for medical tourism and making suggestions so more patients actually end up traveling. So we're adding a lot of benefits to help organizations do the business, you know, better, and be more successful. Even little things like what's on the facilitator, hospital, insurance company's website. I think that's really critical. You know, do they have the information needed for a patient to actually, you know, make the decision to travel abroad? I think a lot of people make the mistake of just saying, I'll just put, we're a great hospital and throw some pictures up and people are going to travel, and that really doesn't happen. And then the other exciting thing I wanted to share for 2020 is we've rolled out medicaltourism.com, and we consolidated all of the websites we built over the last 13 years into one trusted website for both patients, providers, and buyers to get the information they need to make intelligent decisions and connect. So if you haven't checked out the new medicaltourism.com, please do. We're updating it literally every day to make it the best of the best. It includes also the Medical Tourism Index, the rankings we're rolling out the first time, where patients and consumers will see how countries rank in medical tourism so they can make intelligent decisions. The magazine is on there, the association website, and we've also started to roll out campaigns for governments, for hospitals, to reach buyers, to reach patients. We're rolling out as part of membership going forward also. Facilitators, providers, insurance companies will get their own dedicated page where patients can actually contact them, and there's a lot of information. So we're doing a lot of things to try to help, you know, provide more access to industry stakeholders and to patients, and to really drive this industry forward. So I think we're all seeing growth in our business. I know Hady Bupa is growing by about 20% a year in their outbound medical tourism. I know, Karen, more hospitals are moving towards accreditation, and we advocate hospitals to get accredited because the better experience, the more patients are going to travel, the more word of mouth that will happen, the more insurance companies and other buyers will enter the industry because they'll be more successful. And I know, Rand, your patient volume keeps increasing, and you really have found a niche and are crushing it in the China market. So I think 2020 looks more optimistic, but as an industry, we need to come together and we have to make the change and make this industry accessible and successful. So thank you, everyone, for coming on, and have a great day.